Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, we got a very, very special guest. Dr. Sonya Reddy, a cosmetic dentist, is going to tell us about all the great things she does and educate us about sleep apnea. And then a very important segment about the hidden dangers of the Texan abortion law. You're not going to want to miss this one, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on those notifications. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann. And with me, as always, actually next to me today on the couch is Sarah.
Hi.
Because today we have a very special guest, Dr. Sonya Reddy. Thank you so much for being with us today. We really appreciate it.
Glad to be here.
I know you're very busy, and honestly, thank you again for taking time out of your schedule to come and hang out with us. So today we are going to interview Dr. Sonya Reddy, and she's going to tell us about all the great things that she does. But first, is everyone, without getting into politics whatsoever, is everyone very happy the election's over? Like, are we?
Yeah, no more commercials.
Oh my God, the text messages.
Yes.
Yeah, it was a crazy week. Yeah, I have to say, my wife got actually kind of worried about me because I had gotten so obsessed about it, and not because I was pushing any candidate or anything. I just get obsessed about the unknown of it.
Yeah.
And so I was.
Do you messing with the numbers?
Oh my God!
How the newscasters were like, if this goes here.
Oh my gosh! You have no idea. So I was
all
not
the
on
analytics.
I was not on call this past weekend, and my wife was just kind of worried about it because I was just sitting at my computer and I was just looking at numbers and stuff, trying to predict. And so once again, not pushing any candidate or anything, I did put a prediction out on Monday on my X account, and I got 49 out of 50 correct.
That's cool.
Woohoo.
Not bad, yeah.
You should be an analyst.
I know, I may have missed my call. In fact, I did a whole breakdown,
and
and really I only have a few thousand followers on X, so I'm basically talking to not a big audience, but I did this whole breakdown, and it's very bad. It's I'm not endorsing anyone, but this is what I think is going to happen, and yeah, it was 40. I missed Michigan, was the only one I missed. So, but I don't know. We'll see what happens. Obviously, some people are freaking out, and some people are happy.
Some people are relieved. It's done.
I think that I'm 100% in that camp.
Yeah.
I'm so glad it's over. It is what it is. We'll see what happens, and let's move forward and
make
get back
the
to
best
normal
of what
life.
we have.
Well, here, and actually on that topic, I'll ask you a question before we dive into yours. As a plastic surgeon, I actually saw a downtick in business because of the election, because of the uncertainty. Is that something that you, either this year historically had seen in your practice, or is that not as much?
Absolutely. Same results. I think people are all kind of wary what's going to happen to the market.
Yeah, they don't want to spend money.
Yeah. Absolutely. And so they have all waited for this to be over so they can all come back and do. And the stock market is doing good. So I'm sure we're going to see an uproar in the patients that are coming
And I think that would have happened no matter who won. I think it's not necessarily who's going to win. It's just the uncertainty of what's going to happen. And so, as a business owner, I'm so happy it's over. Okay, it's done. Back to normal life, right? So, all right. Well, here I want to kind of jump into talking with you. You're a cosmetic dentist, correct?
Yes.
And so, I just got to kind of ask you some of these just basic questions because I actually don't know it. I've had cosmetic dentistry, and I'll jump into why I had that. But okay, so is this something that you had always wanted to do, or you I'm going to be a dentist, and you kind of got into the more cosmetic side, or how did that all kind of play out?
I think I enjoyed the functional side of it, which is a wellness side of the dentistry, which a lot of people do not realize. I come from a family of physicians.
Oh, really? Okay.
And it was all the, the wellness of it, right? It's not just the pretty teeth. It's about, hey, what's the overall health and function can do.
Absolutely.
And so now this whole uproar about gut health, and that's happened recently. But I think in general, just having a good smile means so much for people, and just confidence. So I think when I got into it, that's a specialty I really wanted to get into. And help them with smiles.
Yeah, and I think you're spot on too. A lot of people just think, oh, this is just purely aesthetics, but there is that health side to it that's the thing that a lot of people don't know about. And I have to admit, although I know it exists, I don't know a lot. So I'm actually really excited for you to dive into that. So when you're going to do the cosmetic dentistry route, like, I assume, is that a fellowship after dental school, or how does that
Yes.
work? Okay.
So dental school doesn't give you in-depth analysis for anything, right? It
Okay.
just gives you foundations of everything. And then after that, students go out and learn so much about either cosmetic dentistry, dental implants, surgery, so whatever
Sure.
you like. So it is an internship. I mean, you
Okay.
can go pretty extensive into it for years together. And there's many other like talented dentists out there that are teaching these courses.
Yeah.
So you just have to dedicate yourself, and also you have to have the art and technical skills.
Sure.
To not
yeah.
just like learn it, but be able to reproduce the results.
That is so, crazy you mention that, because I think that the dentistry pathway from general dentistry to cosmetic dentistry is very, very similar to the pathway I took. I initially didn't want to be a plastic surgeon. I went into general surgery thinking I either wanted to do cardiac surgery or trauma surgery. And then I kind of fell in love with plastics due to the artistry, which I think is very similar to what you were talking about. It's not just the steps, right? You have to have that vision of creating something that doesn't exist right now.
Absolutely.
And it definitely sets at least my specialty apart from the general medicine specialties, and I assume it's very similar to that in dentistry.
Yes, we have a lot of parallels. Exactly. When a patient comes and they want like pretty teeth or they want some cosmetic stuff, we should be able to visualize before and after, right?
Right.
And tell you, I say no a lot of times, and I
Yeah.
think that comes with a lot of, okay, this is not for you. They want to like extract all teeth and get pretty teeth, or they come up with these pictures of celebrities, right? I want
Yeah.
big teeth, and you're blessed with small teeth. I'm sorry, I won't be able to give you all that, but here's what I can do.
Right.
I think saying no a lot, and also kind of reorganizing their thought process of what it's going to look like in the end, right?
Yeah.
And kind of upfront and talk about that stuff, and then they're like, oh, this is a realistic picture of what I'm going to get, versus, oh yeah, sure, give me that filter and I can
Yeah.
create that for you. It's usually really hard.
Yeah, I think that certainly, you're going to have the same things that I have in my practice, which is managing expectations, making sure
Absolutely.
patients aren't, trying to get something that can't be done, and then they're going to be disappointed on the back
Absolutely.
end. Yeah, there's definitely a fine line in that, and it sounds like I talk about this all the time when I'm talking about plastic surgery topics here. It's like you have to make sure that what you're going to be able to accomplish is what the patient has in their mind. And I think, that's where a lot of people in our business fail. I mean, it is a
Absolutely.
skill, like to
Yes.
be able to interpret what they're saying and say, yes, I can make that. And then you say that back to them. Because I think that's where a lot of people get in trouble is, someone will just come in and say, hey, I want this, and then the doctor does it, but it's not the same. What the doctor
Absolutely,
has in their
yes.
mind and what the patient have in their mind is different.
So with this new technology in dentistry, there's so much of new technology where we can show before and after pictures.
Do you use the software?
Yes.
You do? Okay.
Yes. So I show them before and after, and they love it or they don't love it.
Yeah.
And then we go into intricacies, but at least in general, this is how it's going to look. And they love it because they're able to see it and visualize.
Yeah.
No matter how much you're going to tell them, hey, you're going to have this teeth, and they're like, I can't see that on me.
Right.
Until I see it, I'm not going to know. So we do mock-ups as well, and show them like, hey, here's the mock-up of
So,
what it may look like.
It's interesting you mentioned that
Broadly.
because that is something in plastics that they have, and I haven't embraced.
I was going to ask you
Yeah.
that. Like,
So
do you have that?
it does exist. I used it in training, and I think at certain times it's helpful, and then other times it's not, because sometimes what's on the computer is not the end result either. And then
Yes.
I think, at least in my specialty, sometimes what ends up on the computer may not be what the end result is, but the end result is good. But then the
Yes.
patient's like, well, this is what I
What you
thought of.
showed me.
Yeah, right. Yeah. So I like to not to go that. And the other thing I was going to kind of mention too is, it's funny you were talking about that you use that software, because I had cosmetic dentistry. I used to play ice hockey, and I got hit in the mouth. And at first it just kind of gave me some like little cracks, and I didn't do anything. And then I had 2 teeth break right in the front. And so I had to go and get, basically cosmetic dentistry to get it fixed. And I didn't know what to expect. I was like, is this going to look real? Because 2 of my
Yes.
front teeth are not real.
Right.
And I was like, is this going to look real or not real? And man, I was actually, well, first off, they didn't have the computer software.
Yeah.
So I kind of went into it just like, well, I hope this works out. But I was actually really happy. I think most people wouldn't think that 2 of my teeth are fake.
And that's the whole thing. People come to me and say, I want to get cosmetic dentistry. I want to have these like celebrity teeth.
Yeah.
They're white and all this stuff. But I'm worried they're not going to look real.
Right.
And I assure them, that's
they're gonna
the
look
skill.
good.
Yeah, they're gonna look good.
Yeah.
But you gotta, again, it's like selection of the patient for us, and then for them to select. Like there's a dentist every corner, and there's a plastic surgeon, everywhere.
Yeah.
So why do they have to come to us? And I think that's part of like educating the patients. Like, hey, you come to me, this is what I do, and we have mock-ups of before and afters, with patient permissions, obviously. Show them what happened.
Oh yeah, we definitely have the befores now. Yeah, I've been on the fence about the software because people ask me about it all the time. And Sarah, I'm going to ask you, and I'm not putting Sarah on the spot. She's been very open about she has had some surgery in the past. Did they do the computer thing when you went there?
No.
No. Because it was like 10 years ago. I mean, it was in the time.
I think it was more than that.
Oh, okay. Because I mean, they had computers back when I was in training in the mid 2000s.
Yeah, they had computers.
Well, I meant like the computer software.
Can they do that for like fillers and stuff?
Oh,
like
I'm sure
before?
they can. I'm sure they can. But man, having been in this business, because I've been now in plastic surgery since 2007. I've been in Dallas since 2010. And so I've been around for a while. I just worry about the same things with the software with fillers I'd worry about with surgery.
Yes.
It's like, okay, you throw the software in there, there's a picture, and then you get a result that's very, very good, but if it doesn't look like the picture, you will eventually get that patient that says, okay, this is good, but it's not what the picture shows.
Right.
And so that's why
you think that just showing them previous, before and afters is so much better than just telling them, hey, you're gonna look like this, and they're like, I want to look like Angelina Jolie, and now I look like Jennifer Aniston or something.
Right. Yeah. Yes. Exactly that.
They're both beautiful, but.
I mean, we definitely use a lot of befores and afters in my business, but I get a little nervous about having like a picture and saying this is what you're going to look like.
Yeah.
I might say you'll look very similar to this,
yes,
or this is the type of expectation or outcome I'm expecting for you.
Right.
But I would have a little bit of fear, and especially because that's part of a medical record, right?
Yeah.
Your computer pictures. Yeah. So just for me, I'm a little about that. But
I think, do you know any plastic surgeons using those?
Yeah, absolutely, absolutely, they do. Yeah, and they'll tout them. Plastic. I'm sure cosmetic dentistry is the same way. Plastic surgery has become a marketing arms race.
Yeah.
I mean, especially in the Metroplex, it is insane the stuff that you see out there. I mean, I could do an hour segment on that alone. But I wanted to ask you, I know I looked at your socials, and you're very involved with social media, which obviously with me is the same thing. And this is how this whole show came about, was getting on social media. I actually started live streaming on TikTok during the pandemic, and that was kind of the origin of the show. But how did you was that like a necessity for you being a cosmetic dentist to get into social media and just took off, or how did that come about?
I think, it was accidental and also, intentional. The accidental part was like, I didn't imagine it's going to be so big after, a couple of years. And the intentional part was, I want to share my cases,
Yeah.
Some of them had great outcomes, and they came with happy stories. It's not just a smile, right? Mom that could not smile for her 16th, for her daughter's 16th birthday, we're able to give her that smile within 2 weeks.
Oh man, social media eats that up.
So I wanted to show those, and because a lot of people would come to me and be like, oh, I can't get that done because I heard you're going to make it look like chiclets, they're going to be fake teeth, and I'm going to have fake teeth the rest of my life. So I think that I just started just to kind of enlighten people, so it can be done in 2 weeks. There's different, technologies like we're talking about. And then I just fell into it where, I created the community, people were asking questions, and I think I was able to break the whole clinical curtain out, and now I became more personable.
I love that about social media.
Right?
Yeah, absolutely.
And they were like asking me questions directly. My team was answering them. So it became really exciting and interesting part of it. And then, taking videos in between of the patients. Yeah. Patients felt really like part of a community, part of that,
Right.
So
I think that your experience and mine share very similar correlations in that, I basically got on social media because I think the expectation was if you're a plastic surgeon, you have to be.
Yeah.
And then I started doing these live streams whenever TikTok became a thing. And there were times where I'd have thousands of people watching this live stream, and they were just asking questions. And it broke down that barrier of, a doctor's impossible to get a hold of. Like, here's a doctor live streaming, and literally I can ask him a question and he'll answer it live.
Yes.
And I was like, wow, this is pretty powerful. And so, of course, that morphed into this, which is, continue to get bigger and bigger.
Right? We're able to talk about this.
Yeah, you're going to have to get your own show here pretty soon.
It's gonna happen.
And tell me about one of the things I love about you, and I know we just met, but of course, I was learning about you.
Snooping.
Yeah, snooping, right? You got to do your research, right? You got to do your research. I love that you have kind of branched off into these other, I call them side gigs, but business endeavors being the proper word.
Yeah.
I read that you had co-authored a book and you're into coaching now. Can you tell us a little about those things that you've got into?
Yes, I think the whole community kind of, that we created became so big, and, doctors started asking me questions. How do you manage it all? I had 2 practices at one time. I'm a mom, and they were like, you look great and you're on social media. How are you doing this on point when I'm, because burnout is crazy in our profession.
Sure.
So much burnout because we're handling everything. And I always talked about, how we're lonely on the top because you're the CEO, you become like, everyone comes to you for questions. And so I think I just started coaching them as to what worked for me. And, now I became a coach.
So it's like a
platform.
life coach for specific, like for doctors specifically, or just
doctors and executives.
Wow.
It could be, it could be like executive, like it could be women that are like juggling with stuff and nobody to talk to. And I'm also now morphing into executives. It could be like, in a corporation, whatnot. Yeah, I love it. Just the whole best thing about dentistry that I got into is like in the connections, right? Human connections. We're able to do that with the patients. Now I'm able to do it with other people that are like me, similar to me. And I think I just don't feel the competition, right? I don't feel like, oh, you're competing. You're just on your own. Do you do best for you, and then I do best for me. So I love this whole like networking thing that we created.
Of course, the networking's huge.
Yeah, it's like now I'm able to talk to you. Like I have a network of doctors. Like with ENT, I have network with, because this whole wellness practice, right? It involves every doctor.
Sure.
I can't solve all the problems. Sometimes I go in and I notice that there's an ENT problem that I need to refer patients to, and I want someone like you that I can pick up a phone and say, Doc, handle this patient for me.
Yeah.
Do you ever see cardiac issues? Because I know healthy smiles can not interfere, but it's like a symptom of cardiovascular disease. Do you see that a lot?
Yes, the whole sleep apnea thing I got into is, when you have less oxygen to your heart works harder and harder. So then leading to other, cardiac problems and obstructions. So my dad was hospitalized with a cardiac problem exacerbated by sleep apnea.
Wow.
That's how I got into this whole sleep apnea. It can do all of this stuff. It also can cause Alzheimer's and dementia. And that's when I started networking with, more professionals like you, because I want to discuss with you guys, like
It is interesting. Plastic surgery does intertwine with sleep apnea, and I remember that when I was in training. Now, I will say that in my personal practice, because as you may or may not know, plastic surgery is extremely broad.
Yeah.
And so, people focus in different things, and I have a couple of or 3 areas that I really focus in, but the one area that mostly deals with sleep apnea from a plastic surgery side would be craniofacial.
Yeah.
Because you're talking about altering the palate, you're talking about altering the jaw, the uvula, the soft tissue, pharyngeal tissues of the mouth. And so, theoretically, could I do those surgeries? I mean, sure, I had the training many years ago, but in practice, am I doing that? No. So, but yeah, I'm eager to learn about, because I think that you're going to give us some more information about the sleep apnea.
The whole thing you just talked about, how pretty faces, I think, are functional faces that are working well, which is everybody wants like a chiseled jaw.
Yeah.
But the jaw is forward at that point, opening up your airway.
Yes.
And
I think I told you I have sleep apnea because, my one thing that I have is like I don't have like a very protuberant jaw.
Yeah.
And I know that because of that, like it obstructs my airways when I sleep. My wife, I didn't even know I had sleep apnea. My wife had to tell me because it wasn't bad enough, I guess, that,
It's gotten
would you
worse as you've gotten
snore, or
older.
would you grind your teeth or snore or what?
Snore and like stop breathing kind of thing.
Yes.
Yeah.
Oh my gosh.
And I had no idea
it's
because
scary for people that hear you.
like, did my husband
like,
just
is he stopping
die?
to breathe?
Is he dead?
Yes.
And so, I didn't even know it. And so far, to be honest, I haven't done a whole lot about it. The one thing that helps me, I do use those breathe right strips, which that opens up my airway enough, because I think my sleep apnea is pretty mild.
Right.
Like just opening up my airways is enough that I don't have it.
Yeah. The smaller palates are causing narrow airways, right? Like if we can, in orthodontics, the craniofacial surgeries that we're doing is we would put like small tiny implants in the palate.
Yes.
Split them open,
I read
put the
about that.
implants, and then let it kind of.
So you guys are doing that as well?
Yes.
Okay, and is that an OMFS or is that more cosmetic dentistry side? Or
It's not cosmetic. It's more. It's another specialty for during with implants.
Okay.
You put mini implants. You actually
see.
split the palate, open it up.
Wow.
Because people that have small palates.
Sure.
So the whole part is like when you breathe, your tongue is on the roof of the mouth. And so if there's not enough space, your tongue doesn't go all the way. So you're not able to breathe and swallow properly. And then people are becoming mouth breathers. So the whole thing is like, how do we make them nasal breathers? But by expanding the palate, which is a floor of the nose,
Sure.
you get more,
space.
air. Yeah, exactly.
Interesting. Yeah, I haven't gone down the road of like seeking out medical treatment for this yet, but I mean, it may come to that. I think the one thing that helps me is I stay relatively thin. I think if I gained weight, then I think this problem would
becomes
become a lot worse. Yeah,
absolutely.
so I
The
have
second chin too, like people that are like thin are having this because of the jaw being pushed back, right? If you push the jaw forward, you won't have the second chin.
And so I guess for people out there that might be watching this, like. What would you tell them if they thought that they suffer sleep apnea? Like I guess I could probably say, but I'm sure you can do it much, much better than I can. Talk about what should people look for? Like, is there certain signs?
I think mouth breathing. In kids also, kids can also suffer with sleep apnea. I think people don't understand that, and it causes behavioral issues in kids. It's not like the adults have snoring, lack of focus, brain fog, but for kids, it becomes more like a behavioral ADHD-like symptom.
Really?
So if there is an ADHD kind of kid that's not able to focus, I would first look at his breathing, the way he breathes. I mean, watch him at night. It's creepy as it sounds, like watch your kid at night, see if he's, having struggle breathing, or is he grinding? Is he opening his mouth? So mouth breathing causes excessive air to go in and causes, inflammation in the adenoids and tonsils and all that stuff.
Which is, I think that's really interesting because I would suspect that a lot of times when a kid shows symptoms of this, like either the parents or their doctor's first inclination is, well, we need to put them on medication.
Yeah.
Yes.
Which I'm kind of against that. I mean, obviously there are people out there.
We're like a medication-heavy society,
Yes.
right? It's
Yeah,
like everything there's a medicine. But if we really look at the root cause of why is a kid having focus issues, is it really brain issue? Then it could be needing medication. There's some things you cannot avoid, but if it is related to sleep, poor sleep and mouth breathing and all that stuff, they look tired all day. I can share some pictures we can show so they know how the kid looks like. They look, and the mid face is underdeveloped majority of the times.
Sure. Wow. That's something I hadn't really. I mean, you always hear because I've researched sleep apnea for different segments, and it's like, it can affect. It always says mental health, but it doesn't dive into it.
Sarah doesn't have sleep apnea. See, pretty face.
Pretty
faces.
Do you snore, Sarah?
I don't think so. Cody says that I've snored before.
Really?
But I think maybe because I had like my nose was
allergies
clogged
or something
something.
can do that.
Yeah.
Yeah, I think that I do. I do snore, and I think I figured it out. I mean, it's just perfect. It's just due to like jaw shape and the fact that I have more of a retrognathia.
My dad definitely had it, but he was overweight, had cardiovascular disease, and one of my sisters also snores a lot, which she probably what has happened.
Oh, sorry, we just had something up on the screen. Yeah.
Anyways, and my family has suffered from just being overweight and the snoring. Like I remember my grandfather would just fall asleep on the couch and just like snoring so loudly.
Sarah,
my
you
uncles,
won't
all
believe
of
this,
them.
but every patient that has like come to my office, and even if they're like I told you, like, oh, her face looks good, it doesn't look like she has sleep apnea, but everyone knows someone that has sleep apnea.
Yeah.
Your
But
wife would be like, I know.
people don't even try to figure out if they have it. They're just like, oh, I snore.
I snore, and that's how it was. Like, it became a joke in my family because my dad snored so loud, like we could hear downstairs.
Wow.
So for years we were like, oh, dad snore, like he's sleeping, and mom sleeps through this.
Wow.
And then when he was hospitalized, that's when we found out that sleep apnea exacerbated that because his heart was working so hard for so many years.
Sure.
And there's so many behavioral health implications with sleep apnea, just not the heart brain, kidney, everything. You put a lot of stress on the body, causing more inflammation.
Yeah. And I think that a lot of things, one of the things people don't realize is this is a cumulative effect. Yes, one night of snoring is not going to kill you, but I mean, we sleep every single day. And then over the years, it starts to add up to things like...
Well, sleep is just so important anyways.
Yeah, absolutely.
Yeah, and now I think people are more talking about the sleep, right? Like before, it's like, oh, the less you slept and the more power person you are, There was articles on like, 3 hour sleep and I can like function. And now you think it's like gone reverse.
Yeah,
like,
I think Joe Rogan is really big on that. He's like, I sleep 4 hours a day.
I have to say, like, I'm an insomniac. Like,
I would go with
sleep
10 if I could. I would go with 10 hours if I could.
Really? Yeah. Like, I really am an insomniac. I have trouble sleeping, and so I've had it my whole life, which actually has worked out great being a surgeon because like
if kids don't wake us up, it'll be great, right?
Yeah, right.
Yeah, I can wake up with like that. If I hear a noise, I'm like, hello.
I know. Wow. I think it's a mom brain.
Yeah.
Apparently, after we become moms, we only sleep like 20% of the
It's like
quality.
a survival technique.
Because they say like dads sleep fine. It's just like moms with like a small like noise and then you're awake. So.
Yeah, very, very interesting stuff. So if people wanted to find you to, I guess, are you treating sleep apnea patients at a practice somewhere, or are you more?
Yeah, right now I'm a little travel sabbatical.
Oh, wow, great.
But I will be back treating patients. But in the meantime, if they have any questions or whatnot, I'm on social media, Dr. Sonya Reddy, Dr. Sonya Reddy.
I think we have that, Trey. Can you throw up our social? Do we have that plugged into the computer there? Or we can throw it up at the end, maybe. Yeah.
That's me.
That's Sarah.
I can't talk to you about sleep apnea.
Don't ask Sarah about sleep apnea.
Don't ask her
There we go.
I'll send you a link to Dr. Reddy.
Dr. Reddy, yeah. Excellent. And then the last thing I wanted to ask you about, it said you co-wrote a book. Is that was more about the coaching, or?
No, this was years ago, but I'm writing a book about coaching and how, because I told you I got so many questions about how it is to be a CEO and run it all. Yeah. And I have some hacks and all, wellness. Wow.
Moms
stuff,
are so like women in general are so interested. Whenever I had my boutique, my storefront, constantly getting DMs from women saying like, how are you a single mom and are doing this? I feel for you
guys, the single
mom
parents.
Here too.
Yeah, it's difficult, but sometimes I think with you too, just any person, it's like if you are given cards, you just have to play them. And
there's no other way.
You just gotta find a way.
Point being a victim-minded. You just have to.
You just gotta push forward.
Rock it.
Yep.
Awesome. All right. Well, I really appreciate you informing us about all those topics, and I hope if anyone has any questions about it, they'll leave us a comment and reach out to you on social media to learn more. So, all right, we are going to do one more segment. Dr. Reddy, you're going to hang out with us for this one?
I have to get going. Is that okay?
Oh yeah, you can if you have to. Hey Trey, just come back to me. No, thank you so much for joining us. We really do appreciate it. Yeah, it's been a pleasure. All right. Take care. We'll catch up with you later. All right.
Cut that out.
All right, so we are going to move on to one more segment, and I have to say that this actually is going to be one of the more important segments I think we've done in a long time. And I have to say I was wrong on this one. This is something that came up, and I didn't think that it was a big deal. And I have 100% changed my mind on this. And this is about the Texas abortion law and the hidden dangers behind it. And so, I think that this topic really polarizes people, and this is not a segment about that. We are not at all talking about elective abortions in this segment. This is purely about patients, pregnant patients that either have a baby that can't survive or they have a medical condition that is putting their life at risk. And this all started back in 2021 when Texas passed Senate Bill 8, which was basically the heartbeat law that made abortion illegal. And of course, what they did is they made a provision in it that if the life of the mother was in danger, that of course at that point the pregnancy could be terminated. And so when I read that, I was like, all right, well, all aside with elective abortions, as long as mothers are protected, I'm not going to make a big deal about this, because at the end of the day, that's the only thing that's important, is making sure that, the mother's life is cared for. So I didn't think too much about this, and then over the years I saw some things pop up. The first thing I saw was some OBGYNs from other states saying that they wouldn't travel to Texas because of the abortion law and that the risks that they had to them. And at first I didn't think too much of it. In fact, I was just like, well, this is probably just people who are very passionate about being pro-choice that are upset with the law and just are making a protest statement. Then I started seeing data about medical students who were going into OBGYN residency that wouldn't come to Texas because of the law. And I was like, well, once again, this is probably the more passionate people, that want the most women's health reproductive rights, and they're just making a statement about, I'm not going to come there. And then I started seeing some news articles, and I saw a couple right in a row just recently. And Trey, can you throw those up real quick? Those two news articles. I think it's the first picture that we have. Yeah, and so these are two stories about two women. The first one was Neva Crane, an 18-year-old that had a miscarriage at 24 weeks. The termination of the pregnancy was delayed, and she ended up dying of sepsis. The second, Jocelyn Barnica, a 28-year-old, same kind of scenario, was pregnant, had a miscarriage at 17 weeks. The proper treatments were delayed due to the law, and she died also of sepsis.
I have one of my friends, she was telling me about this, this happened close to her, one of her friends.
Okay.
This had happened to her, and she said that the baby was pretty much deteriorating inside of her and was had a faint heartbeat, and the baby had no chance of going to term at all. But they still would not give her the termination of the pregnancy, and she started developing sepsis from it, and it went too far.
Right.
She almost died.
I think that
that's scary.
You just listed out the exact problem that we're seeing in the state of Texas with this, is that although the law does say that if the life of the mother is in danger, that a pregnancy termination can occur, it's very, very vague. And so I think that these three scenarios, the two that I listed where the patients died, and your friend who got very, very sick but thankfully did not die, is the classic example of where this law is not right. The law basically says that if the fetus has a heartbeat, that the pregnancy can't be terminated unless the mother's life is in imminent danger. What does imminent danger mean? Actively dying? Well, at that point, you might be too late. Mm-hmm. And so in these three cases, you have an instance where a fetus has a heartbeat, but the fetus is miscarrying and is absolutely not going to survive. And the mother is not necessarily sick, but because they have to wait, it opens up that chance that the mother can become sick, and sometimes they get too sick.
Yep.
And sometimes, like your friend, they can be saved, and sometimes they cannot. And the reason that doctors are so, hesitant to go against the law is because the law does carry a penalty of life in prison if a OBGYN terminates a pregnancy that has a heartbeat and it can't be absolutely proven that the mother's life is in danger. Well, then that becomes subjective. And you can get an attorney general or some prosecuting attorney that might try to question, that you did this too early. And it's causing a huge problem. And so when I saw these news articles, I was like, well, I know some OBGYNs. I'm going to ask them their opinions. And so my wife is one. Now, my wife does not practice OB anymore. She quit doing OB and got more into the business aspect of medicine. But when I asked her, she's like, yeah, I absolutely would not want to practice in Texas right now. And she's not somebody who ever did elective abortions. We are, once again, not talking about elective abortions. We are talking about terminating pregnancies where the fetus is either dead or the life of the mother is in danger. So I asked them actually practicing OBs here in Texas, and all of them spoke purely on anonymity, which also raises a red flag. When people are afraid to speak out because of backlash of people who, are so passionate about, these laws and that they're correct, I think that it's
a red flag.
It's a huge red flag. It's harmful. We are talking about the lives of our citizens in Texas, and people are afraid to speak out. So the first person I talked to was an older physician, not really, really old, but definitely has been in practice for some time. This was a male physician, and I will also add that this guy is a hardcore Republican. I know him pretty well. And he told me that the law is a disaster. He says that, things like that with those patients dying that are in the news are just kind of the tip of the iceberg, and that there are a lot of cases just like your friend where patients get very sick, but they end up getting saved, and then it just kind of gets swept under the rug because, okay, well, you got sick.
I bet she's going to be scared to have a baby.
Absolutely.
Again.
Of course you will be.
It's going to deter like the population.
Absolutely. It 100% is. And so this guy was telling me that certainly the miscarriages are the biggest concern. And once again, for people who aren't familiar with this means, it means that you have a pregnancy that you want to have this baby, but something happens and the pregnancy is failing and the baby is going to die. And in the past, they would have terminated the pregnancy because that's the safest way to go, but now they can't. And that opens up the risk that the mother could potentially get very sick or die, and we're seeing that. But then he went on to say that there's other things that in the past would have caused a pregnancy termination because of the strong risk to the mother, but not the imminent death risk, and things like uterine sepsis, chronic kidney disease, severe hypertension, heart disease, cancer. All of these things could potentially cause grave risk or death to the life of the mother if a pregnancy continues. And in the past, there would be this discussion of like what those risks were, and did you want to continue with the pregnancy at risk of your own health, or did you want to terminate it? And now that's off the table. Now these pregnancies have to keep going, and sometimes patients do okay, but sometimes patients get very, very sick. Maybe they don't die, but they get permanent kidney disease, or maybe they get permanent heart disease, which is shortening their lives. The other thing he talked about was fetal anomalies. So that basically means genetic issues. And we're not talking about minor things, where you could have a healthy baby with some, minor issue. We're talking about genetic anomalies where the fetus is going to die. It can get carried to term, but at birth, it's going to die. And there's tons of these anomalies out there. In the past, those were generally terminated because if the baby's absolutely going to die, then why are we subjecting women to 6 or 8 months of carrying this fetus, which at any time complications could pop up, and then you're spending all these resources for an outcome that is going to be bad.
Yes.
And now that's not an issue anymore, and you can't offer that, and it's become a real problem. The other OBGYN I talked to was a little bit different as far as demographics. This was a younger OBGYN. She was female. She actually told me that she is a Democrat. And the reason I'm mentioning these political, orientations is to say that this is not a red or blue topic. I mean, it becomes that because everything has become so polarized and everything has become so partisan, but it's not. You have people on both sides saying that this is an issue. And she told me a lot of the same things that the other OBGYN had told me. She said that she personally hasn't seen any, near misses or disasters in her practice like the other doctor had. But once again, she hasn't been in practice near as long. But they both were in agreement that this is a real issue. And so I asked them about, what are your thoughts about, is this having other effects? Like, are you thinking about leaving the state of Texas? Are you thinking about closing your practice down early? And both of them said that is something that they had considered. They also both said that they're trying to expand their practices and get more doctors, and they can't get them. No one is willing to come to the state of Texas to practice, or not no one, but they're having huge problems getting OBGYNs to come here. And I don't blame them. I mean, if you're at risk for going to prison for life for properly treating a patient, why would you come here? Why would you come here? And so there's some news articles that have been out. Travis, throw up that next slide if you can. Yep, here's studies showing that OBGYN workforce is getting strained. There's also been research showing that there's been an increase in maternal and infant deaths since the law has been put into place. Show that next one, Travis, if you can.
There it goes.
Oh, there we go. And then finally, the other thing is that we're getting these large vacuums of OB care in Texas. Fill up that last one if you can, Trey. That last slide. Yep. So, after talking to these physicians who are now saying that for a lot of cases, they're having to get lawyers the hospital lawyers involved in the care of patients to determine if they could potentially go to jail, there is a problem here. And I can assure you 100% that this law is going to change. It's already been revised once. It had to be revised to include ectopics. And what's going to happen is enough people are going to die, doctors are going to leave the state, and you're going to see, you know, potentially doctors get charged for crimes when they're properly treating patients, and this law will get changed. I guarantee you it will eventually, but the question is when. If we can get this word out that this is a problem, then I think that we can avoid a lot of these bad outcomes that we're already seeing. We're seeing patients die, we're seeing doctors not want to come to Texas, and we're seeing patients who can't find an OBGYN. I was wrong about this. I thought that the law was protecting patients. I thought that the law was, you know, allowing for proper medical care to occur. But now that I've looked into this, I 100% don't think that that's happening. And the overwhelming majority of OBGYNs in Texas agree. Something like 80% of them find that there is a huge problem with this law. And once again, I can't say this enough. This is not about elective abortions. This is strictly about pregnancies that are causing a risk to the life of the mother and doctors' inability to take care of them. So
yeah, and honestly, just like do your homework. Like if you have a question about that law, you can easily look it up. Like you don't even have to take your word for it. Just like go look it up.
I think a lot of the problem is just like that, you know, because the law
like there's so much gray area.
Yeah, that's the problem is the law is going to say, oh yes, if your life is in danger, then you can terminate a pregnancy. And that's what the law says. But the devil is in the details. You know, the devil's in the details of like, when does that occur? When is life actually in danger? And people are getting very, very sick because a lot of cases are determined that, okay, your life's not in danger. I mean, they're having to get lawyers involved in the care of patients. Something is wrong. There is a problem here. So yeah, I think this is very important. I mean, if I've ever done a segment that I want people to share and listen to, and if you have people that are very, you know, passionate about pro-life, like I want them to see this segment, you know, because once again, we're not talking about terminating pregnancies that are viable, that, you know, are just unwanted births. I mean, these are, you know, they always have that saying that, you know, abortion is medical care. Well, I hate when they use it like that, because to me, abortion means you're just ending a pregnancy for no reason. You know, this is a termination of a pregnancy for medical reason. There is a absolute distinction in those two, and this is the latter, not the former. So I think it's a problem. I hope people will share this video. You know, because as I said, I guarantee you this law is going to be changed. Enough bad things are going to happen, and people are going to wake up. But how long is that going to take? Is it going to take a week? Is it going to take a year? Is it going to take 10 years? And how many people are going to get hurt in between then and now? How many patients won't be able to find a doctor? How many doctors will leave Texas?
Well, if it's the law, then it's going to take a while.
Yeah, unfortunately, I think you're right. So
yeah.
All right, I think that's all the time we have. Thank you, everybody, for tuning in. We really do appreciate it. Please hit that like and subscribe button. Leave us a comment, and we will see you on the next week of Nip Talk.
Bye.
Bye.